Hello everyone, I am Dr. Rama Krishna Chaitanya, consultant anesthesiologist and anesthesia faculty at Marrow. So today I am very happy to introduce Dr. Pranay, who has secured rank 9 in the recent NEET SS examination. Welcome Dr. Pranay.
Thank you, sir. Good evening.
Good evening. How are you?
I'm good, sir.
Yeah, how are you feeling with this rank 9 in NEET SS?
Feeling good, sir. Was not expecting it because it was a difficult paper this time compared to last time's NEET SS.
Okay.
So a little bit shocked, but really happy.
Yeah, very happy. I can see it on your face also. You
Yes.
are very happy. Yes, very good. So before we jump and know about your preparation strategies and all the things, just introduce yourself so that we get adjusted with, we get know what were you doing and all these things. Your undergraduation, post-graduation, where did you do?
So I'm Dr. Pranay. I'm from Bangalore. So I did
Okay.
my undergraduation from Sri Siddhartha Medical College in Tumkur. I joined in
Okay.
2015 and I finished in 2021.
Okay.
Then I did my MD anesthesia from Kasturba Medical College in Manipal. I
Okay.
joined in 2022 and finished in February 2025, sir. Then I
Okay.
came back to Bangalore and worked as a senior resident in Dr. B.R. Ambedkar Medical College here in Bangalore only.
Okay.
Then I worked till August and then I stopped working and then I started preparing for NEET SS and NISS from August till December.
Oh, very good. So yeah, I think last Dr. Rank 5 is also Manjunath is also from Bangalore only. So a lot of
Yes,
ranks from Bangalore, I think.
yes,
Very good to hear. So I have a lot of questions to ask you, Pranay.
yes,
So you said like you finished your MD in February 2025. It's almost 1 year, and
yes.
in this 1 year you are doing SR shape. And
Yeah.
from, if I'm not wrong, from August you said like you stopped doing SR shape from August. So
Yes.
what were you doing in this, August till January? So what were you doing this all these 6 months, almost around 6 months?
So first thing I made, it was a difficult decision to not work and only study
Okay.
but I realized I wanted to do DM. My DM was my first priority.
Okay.
So I took that difficult decision of not working, stayed at home from August till December and sat and studied for both INISS and NEET SS. So
Mm.
from that time I've been and I've used Marrow even for my MD exams. Sir.
Okay.
So I had used MD for my Marrow exams as well. So I just continued. I had made notes for all the videos. Almost 75% of the videos I had watched from my MD exams from Marrow app. So
Okay.
I just
Very good.
had to watch the remaining 25% of the videos and then make notes and then do the GTs. So that's what I had done, and I was repeatedly studying from August and December. So from October mid onwards, I studied only the cardiac videos, sir, because
Okay.
INISS also I wanted cardiac anesthesia itself. So from
Okay.
October mid till INISS got done, I was studying only the cardiac portion because
Mm.
maximum questions were from cardiac in INISS form.
Okay.
Then once INISS got over, then I again got back to reading all other topics of general anesthesia, neuro, transplant.
Okay. Very good. So I think it's, as you said, it's a very tough decision to take a call after MD, taking a break for preparing for the NEET PG examination, right? NEET SS examination. Because many students, they ask me this question, sir, do I need to take a break? You tell me. You got a rank 9, right? So
Yes,
now, what was running in your mind when you are thinking like I will take a break? Because it's not easy. People will
yes,
start asking you. You finished your MD examination, again sitting in the house reading. So people, family people, they
yes,
don't know what we are running through, right?
correct.
So you have a burning desire to get DM seat, but most of the people, they don't understand how to adjust the finances, or
Yes.
how to adjust the peer pressure. What would you say?
Sir, in that case, I was just little lucky that my parents were supportive. There was no financial stress on me. So that
Okay.
way, the decision to stay at home and study was very useful for me, sir. And I was quite bad at multitasking. I realized that in my previous NEET SS, I couldn't study and work and like do
Okay.
cases every day. So that's when I decided because I knew DM was my first priority. I think 3 months or 4 months of not working would not have costed me a lot in the long run. Yeah, probably
Mhm.
4 months of salary would have is less in my life right now, but I think I'm more happy because now I'll be doing what I really wanted to do since the start.
Okay. Yeah. So always keep your passion in front,
Yes,
because people will start telling so many things.
yes,
You have to take the call at the end. Do you have, obviously when I don't work, after 1 2 months, I get a bit anxious. Am I doing the right thing? Because I have been working, when I started working as freshly passed out of my MD. I was working in cardiac department, because in those days we didn't had any super specialty, so we used to work in cardiac. Then I moved to critical care. Then I finally settled down with pediatric. I do a lot of pediatric cases. Somewhere or other, deep down the heart, I feel very anxious if I am not doing any cardiac case. So in these 3 months, did you get this a kind of thing, sir? Can I give the spinal? Can I intubate the
Yeah.
patient?
So that anxiety I always had, whether I'll forget to give, if I don't get DMC, whether I'll forget to give spinal, whether I'll forget how to put the tube between the cords, whether I'll forget all that. Well, that I always had, sir. But I realized I can do it because MD, there was so much exposure in 3 years of MD. I realized that muscle memory is not going to go. So this gave my 3 months everything what I had to study, sir.
Yes, exactly. You need to just focus, because once you did your good post graduation, hardly
Yes,
it might take 1 day for you to adjust in the new place,
yes,
1 day or 2 days, and after
yes,
2 days, yes, again you will be on the straight back on
yes.
your road. Right. So you said like you were doing, you have written the last year NEET SS, and
Yes.
what was the rank in the last NEET SS?
The last NEET SS I got 198 rank, sir.
Okay.
I was getting DM cardiac anesthesia even at that time, but it was
Okay.
not in the best university, sir. And I wanted to do it from the best. I was not ready to compromise on any lesser average universities. I wanted to do from the best possible college, so that 3 years should be sufficient. I should not be wanting to do another fellowship again after 3 years of DM. So I wanted
Yes.
to be done with everything in that 3 years with maximum exposure. That's why I
Okay.
chose not to take the seat last time and prepared again.
Again, that might be also a tough call, right? Because
Yes.
many people, they might have said, like, once you get the degree, because what is there, the same, you have to put the same tube, do the
Yeah.
same thing. What is the difference? Yeah, I can understand. I can really understand what people might have told to you, or what was running in your mind. So yes, you one from 195 to rank 9. So it's like a fantastic journey. Really
Yeah.
speaking, it's a fantastic journey, right? So how did you prepare in this last 1 year?
Firstly, I used Marrow. So I'd taken the entire plan of Marrow, and I'd done almost 80% of the videos, like I told, sir, like by this thing while during my MD exam. All the MD based topics, whatever I wanted to see for the MD final, I'd gone through in Marrow, made my notes. So that way
Okay.
I'd covered all the topics, and whichever extra topics were there that was being supposed to be studied for an SS based
Hmm.
exam, that I
Hmm.
started to study from August onwards, sir. So
Okay.
slowly did one video, watched initially first round of studies I did all at 1x. I started watching
Hmm.
all the videos at 1x. Then
Okay.
once I took about 1.5 months to cover all the portions. Then
Okay.
in the second time I started watching all the videos at 1.2x. So
Hmm.
that way I could do almost twice before I went for NEET SS, sir. And
Okay.
anyway, and the cardiac part had already been studied well for my INISS exams. So I didn't
Okay.
have to revise much there. So I just had to revise the other portions that I did from once I finished INISS till NEET SS. I just focused on the other, like neuro and neuro, regional, general,
Hmm.
pain.
Okay.
So I just studied all those topics, and that I could cover in 1 month again after INISS, and then I went for my NEET SS.
Okay, very good, very good. So you finish it. That's very, very important point. You said you finish it like almost 70 to 80 percentage of videos, and it took you around 1 to 1.5 months of time, right?
Yes.
So yes, definitely. Yeah, what books you have referred in this entire journey of preparation?
Sir, books like textbooks. What mostly I've done Marrow only, sir. Like no,
No.
I did not have any separate book because I wanted to keep it quite simple. I just wanted to follow one source. Didn't want to
Okay.
complicate things. So mostly it was Marrow, and then if I had any doubts which I needed something, then I would follow standard books like Barash was there,
Okay.
and Dosh and Dosh for any equipment. And
Okay.
then I solved other MCQ books like Brian Hall and Lipid Cots. Also, all the MCQs, at least I solved them twice before going for the exam. And all the
Okay.
question banks in Marrow also I had solved at least twice.
Okay. So Q banks. How many GTs? GTs. What about the GTs?
The
Now,
GTs,
which?
I think from February onwards, I think there were some 5 GTs, sir. So I
Hmm.
had given all those 5 GTs before going once.
Yes. Okay, very good, very good. So during your post graduation also, if I'm not wrong, you started watching Marrow videos, right?
We So during post graduation, I did not give any GT, sir. I just watched the
Okay.
videos, made my notes, but
Yes.
all the question banks and GTs I started from August only, sir.
Yes, very important point you said, Dr. Pranay. If I ask you one question, what was the reason why you didn't, you got a rank of 195, which was not expected in the first attempt, and what
Yeah.
was the difference from first exam to the second exam, from the preparation strategy or from the focusing point?
Sir, I think last time, because the exam was just a few weeks after I finished my PG, sir. So I
Okay.
think that way I don't think I revised much, because I thought I'd just finish my exam and everything will still be in my memory. But I didn't realize anesthesia is such a volatile subject that you can just forget everything in a week.
Yes,
So
yes, yes.
that was a slight error I made last time, but then that I realized I could change it this time. So I revised well. And certain topics in anesthesia need to be revised again and again, especially when it comes to vaporizers, Mapleson circuits. So you
Okay.
have to keep revising it again and again, or else it will only evaporate.
Yes,
So I
yes.
think studied that much better the second time, sir.
Very good, very good. Dr. Pranay, a very important take-home point you said in your words. Focusing on one thing, getting the basics right, and
Yes,
adding to it, doing lot of GTs,
yes,
MCQs. You said you covered the brain and all, you covered marrow GTs, five
yes,
GTs you have practiced. So that's what might be the biggest change from 195 to
yes,
rank
sir,
9.
for sure. And
But
this time's
many,
paper was much harder, sir, compared to 2024. This time's paper was much, much harder.
what do you mean by harder here?
Sir, I think last time it had enough of general anesthesia, sir, in
Okay.
2024. This time I feel specialties were asked more than general topics. And
Okay.
there was much more of neuro anesthesia this time compared to before.
Yeah. Right, right. So compared to like where the questions were clinically oriented, or they were like more of factual based content.
Sir, that was kind of mixed, sir. When it came to specialty questions, most of them were scenario based only. When
Okay,
it was
scenario based.
Yeah,
Mm.
general anesthesia side questions, most of them were one-liners, but those questions were one which we would easily ignore and go before our exams. Things like sterilization and disinfection was asked. So those kind
Mm.
of topics we usually ignore and go before the exams. So they had asked questions from those topics which usually we don't tend to see before exams.
Okay.
And 2024 it was quite direct, the general anesthesia part. But this time the general anesthesia part was more confusing.
Oh, nice, nice, nice. So, as a person who has secured rank 9, so if I ask you, imagine I'm a first year postgraduate for you, and I
Yeah.
asked you, sir, what should be my preparation strategy? What will you tell?
Yeah. So first, I think you have to decide whether you want to do a DM in anesthesia or not, because
Hmm.
there's so many options after doing MD. DM is not the only option. But I think once you've made that decision, I think you have to have passion towards it and dedication towards, like, I'm going to do this no matter what I hear from my surroundings, what my other colleagues may tell. Fellowships are easier. We can do fellowships. But once you have decided that you want to do, you have to do hard work towards it till the end. Be passionate, be dedicated, and just believe what you're doing is right. People will tell 100 things, but you need to believe what you're doing is right till the end. And you have to have the right mindset, and then I'm
Oh,
sure it'll be possible.
yes, yes, very, very, very important thing you said. Like, people will start telling you why to do DM. We can
Yes.
manage with, fellowship, 6 months fellowship are there. People will get easily that fellowship also. You need not write any competitive
Yes.
examination. So why again go and, struggle in the new department for the next coming 3 years, sir?
Correct.
Right? So imagine I'm a first year. I don't know about anesthesia. I'm not oriented like towards DM anesthesia, but
Correct.
somewhere or other, I wanted to take some guidance from you. So what will you tell? Because many first year students, second year students, they do watch these videos. So
Yes.
you tell me, as a person who got a rank of 9, which is a commendable rank. So those who are preparing after their post graduation, they might have understood how difficult it is. I can understand, like, if they are focused, they are working towards their goal. That's good. But
Yes.
for a first year postgraduate, if he is watching this video, he should gain something. So what would you advise him?
Sir, I think first thing I'll tell is focus in your OT. Like the amount of knowledge you can gain by just doing daily cases is a lot. And a lot of OT scenarios are only coming as questions in the exam. So focus every day, do your cases, do your PAC well,
Okay.
speak to the patient, doing the right airway examination, take
Okay.
every case differently, do it, learn as much as possible from the OT about the anesthesia machine, vaporizers. There's so much we can learn inside the OT, and I
Yes.
think treat every day as a challenge and be productive and do your work
Okay.
diligently.
So, just as a first year resident, again, I'm asking you one more question. Yes, sir, you are saying like do this, but there is no one in my hospital to teach me. What should I do?
So then, like I told, like if taking Marrow will be more than sufficient because I think all the topics are really nicely covered. Whether it comes from say your videos, then general anesthesia videos, then Himesh Imam's videos from cardiac. It's all the videos initially start from physiology, then they go into depth of the topic. So it's taught very systematically and taught well in our Marrow app. So I think
Okay.
taking that Marrow app from the first year itself will be very helpful. If if there's less of academics in the college, then I think Marrow will be more than useful for 3 years, and you can definitely pass not just MD exams but get a good super specialty seat as well with Marrow.
Okay. So one more question. As a first year resident only, I'm asking you, sir, there are so many videos in Marrow, sir. Is it necessary for me to watch? Because this is a common question which
Yeah,
I
yeah.
feel many students ask me the same question.
Because I think, yes, sir, at least initially you have to start watching every video because anesthesia is completely a new subject and not a lot of us are exposed to anesthesia in internship or in MBBS as a whole. So I think to
Mm.
learn from the scratch anesthesia is very important, from the basics of pharmacology to the pharmacokinetics. Each and every video is ideally important, and it's
Mm.
very important somewhere either in your SS exams or your MD exams or basic physiology is very important to see all videos. I think each and every student should see every video, make their own notes as much as possible
Yes.
because your own handwriting is what is going to help you at the end, not the printed ones. So I think making notes is very important.
Did you made your notes, doctor?
Yes, sir. I made notes for almost all videos, sir.
Oh, okay, right. So you used to write, like, how did
Yeah.
you write? Because time management is, as a first year resident or second year resident, this time management is one question which I get repeatedly asked by the students.
Sir, yeah, PG is going to be hard, sir, but somehow you have to manage like 1, 2 hours a day. But if
Okay.
some people have the habit of watching videos at a faster pace, that is also good. You
Mm.
can watch. But initially, I used to watch on 1x only, sir. Like because I
Okay.
wanted to just go through once the video very
Mm.
nicely, and then whenever I got time, I was free time. I would always hear it in 1.5x at a faster thing. But when I used to make notes, it would be slow.
Okay. So were there any good, like, how was academics during your PG days? Just
Sir,
casual question.
our PG days academics was good, sir. We had classes every day from morning 7:45 to 9 o'clock, and then we
Okay.
used to start OT. So a lot of topics would get covered from the academic session also. Then those videos I would always go back to Marrow and then watch it at a faster pace so that I could cover it again. So I would have a second thought about the video. So in that way,
Okay.
if academics is good, it's always good. Or else I'm sure Marrow is just taking care of everything, sir. And we have good
Okay.
case discussions also in Marrow. ABG videos are there. All practicals part is also taken care of. So through
Yes.
and through, it's a good package till you get your SS seat.
Okay. Sir, now tell me, I am a second year postgraduate. I got adjusted in the department. I know some techniques. Now what should I do? Shall I focus on improving, because juniors are also came, they are also competing for the procedures to give the blocks. Now, how should I utilize my marrow?
Sir, I think because second year, I think is one of the best times in post graduation because you go to all departments. You're going to cardiac, you'll go to neuro, you'll have district postings as well, where you get
Yes.
to have more free time there. So I think those are the times where you can really utilize these Marrow app and go through as many videos as possible. Go through your ABGs. You can get your clinical skills also done. You can go through case discussions because in third year you will present cases to your department, so you can even
Okay.
finish those. So second year, I think, is very crucial, sir, in that way to go through as much as possible in Marrow videos and make your notes. I think,
Mm.
and then because in third year you can always get ready for your exams.
Very good, very good. Doctor, I am a now third year resident, so I am watching this video. I just wanted to tell you that, sir, with this thesis work, case presentation, managing the OT as a JR3, it's not working. What should I do?
Sir, I think time management is one important. I think in OT times, I think I've never studied inside an OT, sir. Like I've not actively tried to study. Yes, I've gone through articles whenever any staff has asked me questions, like go through the latest guidelines. But otherwise,
Mm.
never made an active attempt to study in my OTs because I've always
Okay.
focused on the case because there's so much to learn in every case that way. You'll have epidural infusions to change and drugs to be given. So I
Mm.
think focusing on the OT during OT hours is important. And then once you're done with the day, I think 2 hours a day is not so hard to take out from any busy schedule to just go. And I think in 2 hours, you can easily do around 2 videos. That is a good amount of knowledge that
Mm.
you're getting in the videos, sir.
Okay, now tell me, doctor, when you are doing the OTs, did you had any seniors who were constantly bothering with questions, or did you ask your juniors questions regarding the cases, which that might have helped you, right?
Yes, sir. So initially, we were not so lucky that we had seniors with us in OT, sir, because we had joined in 2022 where it was that COVID peak era. So
Okay.
we didn't really get seniors. So we had staff. Our staff would ask us questions on a daily basis. Only once
Okay.
we answered the questions properly would we get procedures. So that was
Um,
standard in this thing. And then
Standard
once,
protocol
yeah. So
throughout the
once,
departments.
yeah. So once
Yeah,
we
yeah.
got juniors, we would make sure that the junior would study few topics and come volatile topics. Especially when I was JR3, when exams
Okay.
were close by and the new batch had come, we used to
Hmm.
tell them to go through some topics and come so that it would help us and help them, and we would discuss in the OTs when the cases were going on. So that is also
Oh.
one that as a JR3 you can not just trouble your juniors, but also you can teach them and
Hmm.
get taught by them as well.
Yes, yes, very, very. That's how the department should run once the cases are done. Because I see a lot of juniors, JR3s, they said like, sir, thesis work is there. I will not come to the OT. You man, JR2 is there. He will manage. If something goes wrong, I will come to the operation theater. So all those things. Yeah, okay. Now tell me, as an SR, you worked for a period of around 6 months, more than six
Yes.
months, I think. Right? So how was there? How was the working, and how did you balance it in between? Because SR means definitely you have to take the responsibility also.
Yes, sir. Like I joined SR because I wanted to work on my decision making skills also, sir. Because as a postgraduate, we're always discussing the cases with our staff and then deciding. So over here, and
Okay.
I was the staff. So in that way, I wanted
Mhm.
to work on my decision making skills. But yeah, I chose such a place where I could focus on my studies also, sir. The load was decent. It was we used to start OTs by 9 and finish by 4:35, sir, daily. So I chose
Okay.
such a place where I could give time to both building my decision making skills, doing cases, and in the evening times preparing as well, sir.
Wow, very
So
good. So, you are like complete, you are using the Marrow app, and you are focused. You are focused, like, you don't work as an SR in a very high load place,
yes, sir.
because your target was DM, right?
Correct.
That's a very, that's wise decision. If you ask me, like, that's a good judgment what you made.
Correct.
So when you are doing as an SR, like, when you encountered any difficult cases, so what was, something has gone wrong, you might have encountered, right? So how did Marrow help it? Like, when you are simultaneously using a lot of videos also, right? So how did Marrow help it then?
So that way, whenever I had a difficult case, I would always the previous day only I would go through the videos, sir. Like if I had a scoliosis case next day, I would go through the scoliosis case discussion video. So certain things,
Okay.
that points that I would not remember because it's been a while since I would have done a scoliosis. So those points would get covered in Marrow, and then next day in
Hmm.
the case, I would make sure that all these concerns are taken care of, and that way it would be like a good revision for the topic as well. And I would make sure the case also was done in the right way. And
Oh, nice, nice. So this ABGs and all case discussions, so you were constantly following them, right?
yes, sir, yes, sir. Like I would constantly go through ECGs and ABG videos and X-ray videos as well, because we would on a daily basis you are seeing ABGs you're doing, and you tend to forget also these topics very easily. So I would go through the notes of such videos as well and make
Okay.
myself better with all
Okay.
this.
Now tell me a very important question, sir. I finished my MD. I finished my SR ship. I am like, I wanted to do DM. Now this year DM I couldn't crack. Okay, you tell me, shall I drop or shall I do a job or shall I prepare? How to prepare? How will you answer this question?
This question again, sir, I think you should discuss with family first. This kind
Yes.
of decisions you can't just make on your own because we're still young. They've seen more life. I think if family is okay, if you there is no
Mhm.
family stress that you have to be the sole breadwinner of the family, then
Yes.
definitely I think initially maybe 5 6 months you can work. But I think it's the most crucial phase is that 45 to 50 days before the exam, sir. Even if you
Yes.
work throughout the year and studied, that 45 to 50 days is the core revision period. So I think at that point of time, at least you have to take a break from work and give the entire day to studies because it's very difficult to work till 5. Then you need 2 hours of break. Then again, you'll just have 3 4 hours. So, but I
Yes.
think that 45 days before exam, you have to stop work and then just give your entire day to studying because you can't study a lot as well when it comes to anesthesia. It's a that kind of a subject where you can't study 3 4 hours in a row. You can do 2 hours and then your energy levels will drop. So you
Yes.
need a
Yes.
break. Then again, you have to start. So that is very difficult if you're working. So I would suggest you can work, get a good job, get good with your decision making skills, but and keep studying, keep using Marrow. But 45 days before the exam, give it a
Stop it.
break, stay home, study every day, and revise and go well for your exams.
Wonderful, doctor. Wonderful. Sir, you exactly said what is meant to be, right? I felt like, you are telling the right words to the juniors because many of these students, they are in a confused state. Those who
Yes,
passed MD also, those who couldn't crack also. Just now also, students, they message me, sir, I got 292 rank. What should I do? Shall I do the job or shall I continue? So these questions, you answered it very precisely,
yes,
basing on your experience. And definitely, the whole check, if you ask me, like, your main source, what I can understand is the Marrow videos,
yes,
and revising, and whatever the GTs, MCQs, whatever that are there, you finished it off. Wonderful, doctor. It was like, it's like, a very, very full-fledged pack for you, where you
yes.
have got your rank. Very, very happy for you.
Thank you, sir.
Yeah, and how is your feeling? How are your parents feeling? And how are you feeling, like, at the end?
So to be frank, I didn't think that this could be possible where I have a good INSS rank and NEET SS rank and I'm able to choose what I feel like. That itself is a very blessed feeling that I'm having. It's almost that cloud 9 feeling that everyone says that right now I can choose
Yes.
which university in country I want. I can get a seat there without
Hmm.
thinking what is the cutoff will I get. I'm sure I'll get for my rank. I know I can get any university in the country for cardiac anesthesia. So
Okay.
that's a
So you,
wonderful to have.
hmm,
So very
you
happy
want to
everyone.
do cardiac anesthesia, right?
Yes, sir. I want to do DM in cardiac anesthesia.
Very good, doctor. So it was very inspiring journey, and it was like, the tough calls what you made. I'm
Yes,
really proud of telling you, like, it's not a easy thing which you
yes,
made a call, like, stopping from August, because I can, even if I don't work for the next coming 10 to 15 days, I always
yes,
feel, am I doing the right thing? Am I
yes,
am that kind of thing. You just, one bow and arrow. You said, like, yes, I want this. I have to do this. That's
yes,
that's
sir.
the precise answer, which is like, and the take home point is, if you are having, use Marrow efficiently, because the videos might look lengthy, but it's
Yes,
not 1 day or 6 months exam. It's
yes,
3 year journey, and after that also we have a lot of journey in anesthesia to be followed. So get your basics right. That's what is the
sir.
take home point, what I feel from
Yes.
Dr. Yeah. So last concluding statements, Dr. Pranay, what is your final telling to the students? Like, what you want to say?
So just be focused, be passionate, work hard, work day and night if it is required in your OTs.
Hmm.
Once you can work day and night in your OTs, then any exam that comes, you'll definitely ace. And be
Yeah.
punctual, be very hardworking. Do not every day is a new day. You have to do what is need to be done on that day. Don't postpone things. Make wise decisions. Discuss with your staff. Discuss with your seniors, and only
Hmm.
make good decisions. And I think be thankful to everyone who's helping around you.
Hmm.
And I think it's very important. One thing, sir, you have to thank yourself because you're
Yeah.
making these hard decisions and you're putting the effort. So I think each and everyone should thank your own self. And in that way, I'd like to thank myself also, sir, that I
Yeah.
put the effort and I could have easily adjusted for less, and I didn't do that. And that is very important, not to adjust for less, try to do it in the best university possible. And I'm sure everybody will do it.
Yes, wonderful, wonderful, doctor. Very, very happy for you. Wishing you all the very best for your future. And
Thanks so much.
God bless you. God bless you very much.
Thank you so much.